globally, HIV is down 51%. But not in Latin America. There are at least 2 million people living with HIV in the region. Tell us about PAHO's efforts at the moment to advance HIV response in the region.
New infections have an increasing trend, right? We haven't been able to change that trend and much less get to the low targets that we want to get to end AIDS. And for that, we have one priority. Well, we have many priorities, but we have the priority of combination prevention. And within that, it's PrEP, pre-exposure prophylaxis. It is a medication that can be given orally. At least right now, it's orally. There are innovations for injectables, but that is really not available at the current moment. But we need to increase the provision of PrEP, and we need to increase the demand. In places where PrEP is available, there's still not enough people interested and knowledgeable and accessing PrEP. So the target is to have 2 million people on PrEP. That is in the region. And right now we are about at 180,000. So we have a long way to go. The countries are making efforts. There are public policies for PrEP in the majority of countries, but still the number of persons on PrEP is insufficient to make an impact in changing that trend of increasing new infections. In addition to the new infections, we have the deaths. And you have to think that with the current treatment that we have, nobody should be dying of HIV.
Still, there's a significant number of deaths in Latin America and the Caribbean. Those numbers are decreasing now, thanks in part to new tools that enable access to easier and faster treatment for infections.
And in addition to addressing the people that are already on advanced HIV situation, we have the rapid test, the self-test that countries are using, but that needs to be expanded so that people can be more autonomous and be able to do an HIV testing in the privacy of their own home. Because as we know, and that is another barrier that we still have to work on, there's still a lot of stigma and discrimination. So these self-tests is a way for a person to know their status and to access the medication in a much earlier phase of the infection, and of course improve their health and prevent transmission.
Health organizations around the world say discrimination and stigma remain significant barriers to accessing HIV-related care. These barriers particularly affect key populations and affect access to health services in the HIV prevention and treatment systems. And is that why we're still seeing some deaths today, is because of the access and the stigma allowing the disease to grow?
Exactly. So what happens is that sometimes people are not diagnosed, and they are only diagnosed when they're very sick. And so their probability of death increases, right, when they're extremely immunodeficient. But also some people have been diagnosed, have been put on treatment, but you need to take your medication every day. And sometimes countries are providing the medication in a way that is burdensome to the individual. For example, in some countries, they still have to go every month to pick up their medication, or every 2 months. And so we are promoting to implement something that we call multi-month dispensing. So persons can have their medication for a longer time. They still take it every day, but they don't have to go to the health services so often and not disrupt their normal life. And so in that way, they will be able to maintain their treatment. The other group of people that arrive with this advanced immunodeficiency is persons that were on treatment, that stop their treatment because life occurs, right? Things occur in their life that for whatever reason, they stop going to the health services and they stop taking their medication. And then after some time, they may develop an opportunistic infection, and so that's how they get back into the health system and health service. But the idea is to prevent this and not only treat it, but to have people continue on their medication lifelong.
What are some bright spots, any success stories with certain countries where you have been seeing real strides where HIV is under control, there have been huge improvements in prevention and in treatment?
Brazil has been advancing so much on PrEP provision, and they have the target of at least 3 persons on PrEP for every new diagnosis. And in some municipalities, in some states, they have been implementing these novel ways of delivering services that protects the confidentiality, the privacy, reduces stigma. And so I think that is a very good innovation that other countries could replicate, right? This teleprep provision. Also, during the COVID pandemic, to not interrupt the provision of antiretrovirals, some countries implemented delivery of antiretrovirals to the person's home or through the community, through civil society organizations or through peers. And those are also good practices that we should keep on doing to improve the barrier, to reduce the barriers to health services.
Another preventable disease that has been increasing in Latin America, syphilis.
The region of the Americas has the highest burden of syphilis worldwide, and it is increasing. It has increased about 30% in the last 5 years. And this is very important because it is affecting all different population groups, right? And if it affects the pregnant woman, it will cause congenital syphilis if left untreated, and that is an extremely important adverse outcome. The baby can it can die, it could be an abortion, it could be a stillbirth, or the baby can have congenital defects, mental retardation, and this can be easily solved with treatment, which is extremely cheap, which is penicillin. And, but still, there's a lot of barriers to the health services. There's a lack of knowledge about it. And only now there starts to be more awareness and more interest. Countries are declaring National Syphilis Days to raise awareness. Some countries like Brazil are now promoting that trained nurses can prescribe and provide treatment for syphilis as a way to facilitate access to healthcare services instead of having the person come one day, get tested, go back to their home, then come another day, get treated, to just have like a one-stop shop. You get tested and you get treated same day, same morning, or same afternoon.
Are you optimistic heading into 2030 that a lot of these goals will be achieved?
We just need to garner more social support, more knowledge, have better coordination, and work between the different sectors. Like the academia, there's extremely knowledgeable and interested researchers in the area of syphilis, for example. Governments are now also more interested. We do have the commitment for the elimination of mother-to-child transmission of congenital syphilis. Civil society starts to become more aware and also is advocating for better response. So hopefully, between all of us, we can make a difference and achieve those goals.
Dr. Monica Alonso, thank you for joining us.
Thank you. It was a pleasure.